Good afternoon. Good afternoon. I'm Jennifer Gross, CEO of American Friends of Tel Aviv University. I'm delighted to welcome you to today's webinar, Dental Anthropology and Clues to the Past, featuring Professor Rachel Sarig. Today's webinar is being co-hosted with the Alpha Omega Foundation US. Founded by Jewish dental professionals, the Alpha Omega Foundation US exists to engage, inspire, and provide public support for oral health in the United States and internationally. The organization has generously established scholarships for deserving dental students at Tel Aviv University's dental school. We thought it fitting to have Dr. Mark Rothman, a board member of American Friends of Tel Aviv University, a Tel Aviv University governor, and the chairman of the Alpha Omega Foundation, introduce Professor Sarig. Dr. Rothman is a board-certified oral and maxillofacial surgeon and chief of the Division of Oral and Maxillofacial Surgery at the Albert Einstein Medical Center in Philadelphia. Mark is incredibly generous with his time, and I would like to personally thank him for clearing his calendar in order to join us today. Mark.
Thank you, Jennifer. Good afternoon, everyone. I am pleased to be here representing both the American Friends of Tel Aviv University as a board member and also the Alpha Omega International Dental Society, where I serve as chairman of the United States Foundation. Now, before I introduce our distinguished speaker, I want to briefly share with you a short story. It starts in 1907 with a group of young aspiring dental professionals, deciding that it was important to form a group which would empower them with self-determination over educational pursuits and careers. These young Jewish men were fighting an uphill battle against discrimination and anti-Semitism, and they formed the Alpha Omega fraternity. Now, fast forward 41 years and the state of Israel is born, and with it, the same goal of establishing a country where Jews could determine their own destiny in their historic homeland, free from the discrimination and persecution that plagued them in the diaspora. By now, the Alpha Omega fraternity had grown to thousands of members worldwide, and they took it upon themselves to build over the next 30 years 2 dental schools, one in Jerusalem and one at the Tel Aviv University, led by the philanthropic arm of the Alpha Omega, our foundation. We have raised millions and millions of dollars to support research, care, and development at these schools. And most recently, we renovated the Rothstein-Williamowski clinics at the Tel Aviv Dental School. I implore you to go and see this beautiful state-of-the-art facility for yourselves when on campus. It is a premier institution, both for the care of those with special needs and the education of doctors in this specialty. And it is also really, really beautiful. Now, as a Jewish dentist, I firmly believe that if I do not support Jewish dental institutions, then who will? And as a result of my involvement with the dental school, I have been able to witness the marvel that is Tel Aviv University. It's an institution providing superior education, promoting academic freedom, and benefiting the state of Israel and advancing scientific knowledge. It is a place that has produced outstanding researchers and clinicians, such as our presenter today, Professor Rachel Sarig. There is really a lot to say about her credentials. She is Israel's only dental anthropologist. She is a practicing orthodontist, a professor in the Department of Orthodontics within the Department of Oral Biology at the Maurice and Gabriela Goldschlager School of Dental Medicine at the Faculty of Medicine at Tel Aviv University, founded by the Alpha Omega fraternity. Professor Sarig is an acclaimed researcher who established Tel Aviv U's Dental Anthropology Lab. She is a curator and researcher and was recently one of the leading scientists on a team that was credited with discovering a prehistoric human. In her role, she takes an active part in numerous archaeologic excavations and is often asked to analyze and define the origin of prehistoric teeth. Professor Sarig is an alumnus of Tel Aviv University, where she achieved her dental training and a subsequent doctorate in anatomy and anthropology. She is also a summa cum laude graduate of the dental school's Department of Orthodontics. Her main research interest is in studying the evolutionary and environmental effects on oral health in prehistoric populations and their implications on modern societies. It is my pleasure to turn the program over to Professor Sarig.
Thank you very much, Mark. You said so much. I don't know what else I can say now after this introduction. So hello, everybody. I will now share the screen with you. Just let me know that it's working. Okay. Do you see my screen?
Yes,
Do you see the slides moving when I move them?
we see the slides on the side and we see your slide in the middle.
Okay, 1 second. Let's try again. Sure. So do I have a way to communicate with the people who are listening? Can they respond to me in the chat if
No,
I ask?
they can ask questions in the chat.
Okay.
And then I will, I'll pose those questions, but you can't communicate directly.
Okay. So if they have questions, you let me know, right?
That's
Okay.
correct.
So as Mark said already, do you see the slide now moving?
Yes,
Okay, thank you. So as Mark said, I'm a dentist, I'm an orthodontist, and I guess most of you know what an orthodontist is, right? Most of our children had to go through a orthodontic treatment, so I don't think I have to say much about what it is to be a dentist or an orthodontist. But what is a dental anthropology? So this is something not all of us know. I can say that I wasn't aware of this profession before I got to the university. So dental anthropology is actually the study of the biological development of humans within past and present, based on the teeth, or actually based on the masticatory system. What we mean by saying masticatory system is including the teeth, the jaws, the muscles, whatever is involved with mastication. So we're trying to analyze and explore the development of humans by analyzing their teeth, their dentition. And when I do dental anthropology, so obviously it looks a little bit different than what I do in the clinic. We participate in archaeological excavations, and you really have to put our hands into the soil, into the ground. I really like it. It's really different from being in the clinic. But luckily, we're using very similar instruments, very similar tools that we do in the clinic, because once we find bones, when we discover the evidence of bones or teeth in the excavation, we have to dig really slowly and do it very carefully in order not to damage the specimen. And you probably ask yourselves, I sometimes ask myself, how do I get from being a dentist or an orthodontist to study archaeology or evolution, which is quite different. It's not like a field that goes together. When I studied here in the dental school, we didn't deal with evolution or with anthropology. This is something that most of the dental schools are not dealing with this subject. So how did I get to this field? It's actually because of that tooth that you see here on the screen. If you're a dentist, I don't know how many dentists are in the audience, so Jennifer or someone can tell me. I don't know how many dentists are here, but if I could talk to you, I would ask you, can you identify this tooth? So that tooth is obviously a premolar, a lower premolar. And when I finished my dental school in 2005, and I started working on my PhD. My PhD was dealing with dental crowding and grinding and attrition of teeth. I was really interested in the reasons for dental crowding. And I was sitting in my lab, my supervisor, Professor Israel Hershkovitz, who is a physical anthropologist. He came to me one day and he told me, we're excavating in Kesem Cave. Kesem Cave is in the center of Israel next to Rosh Ha'ain. And this cave is very unique. It's dated to be about 300,000 years before present, which is a very unique period in Israel. We don't have so many fossils in Israel from that time period. And we found the only human remnants that was found in the excavation was teeth. They could only find teeth. And at that time, he came to me and they said, you see, this tooth was found in the excavation and you're a dentist. What can you say about that tooth? I mean, you probably know something as you're dealing with teeth all your life. So tell me what you think about that tooth. And I was sitting in the lab, I was looking at the tooth, and I really didn't know what to say. I said, okay, it looks like a regular tooth. It has a long root. I don't know, it has a very nice crown. It was very hard to believe that it was lying in the ground 300,000 years. But I told him, okay, what do you want to know about that tooth? So he told me, I want to know the origin. I want to know who the people who lived in the cave. And I said, how can I tell you anything about the people who lived in this cave based on one tooth? So I said, okay, I will try and ask. I will try to look for the answers. I took that tooth and I went to the dental school, to my home where I studied. I just graduated. And I asked my professors from endodontics, periodontics, all my professors. I went one by one and I asked them, what can you say about that tooth? What do you think? And really no one knew. So then I started looking for answers. I went to Jerusalem. I met with Professor Patricia Smith, which was already retired back then. And she actually exposed me to the field of dental anthropology. She taught me the differences between Neanderthals and modern humans. And whatever we can investigate and any information we can get based on a tooth. And what she told me, she said, if you want to identify the tooth, you have to compare it with other specimens. So you have to look at other teeth from different origins, from different time eras, and by that you can identify the origin of that specific tooth. So I said, okay, I'm a good student. I went to the anthropological collection in Tel Aviv. We have one of the largest anthropological collections in the world. We have more than 15,000 specimens representing the entire scale of human evolution, starting from more than 1 million years ago until recent. This collection is curated at the Dan David Center for Human Evolution at the Sackler Faculty of Medicine. So this was the first time I entered the collection. It was about, as I said, about 2008 maybe. And I opened the drawers and I saw hundreds of teeth and I was amazed. Each drawer, it was like, I don't know, it's like a riddle. I felt like Sherlock Holmes. I remember coming home, I said to my husband, you cannot imagine, I found a treasure in that basement. And I was looking at the teeth again and again, opening each drawer, and I saw all the specimens that were there. And one of the things that strikes me when I was looking at a collection is even when I was looking at specimens, like you can see here, the jaw, this is a lower jaw, the dentition of a specimen from Hoalo, which is dated to be 22,000 years old. And I said to myself, wow, they had like perfect occlusion. They have no crowding. They don't have caries. They have perfect teeth. And I was opening another drawer and another one. And I said, wow, it's amazing. They had better dentition than we have. And I was comparing it to the dentition that we see in the clinic, you know, how our patients approach to us when they come to the clinic. And I said, how rare it is to see full dentition, having the third molars, the wisdom teeth erupting, and you even have enough room for another tooth if you need it. I mean, they had such a perfect occlusion. Why do we suffer? Why our children have such bad occlusion? Why do we have so many pathologies? And then we started thinking about it and we were looking into it. And, you know, I looked into the research, and this is just, I know it's probably shocking to see these pictures of the screen, especially if you're not a dentist, so I apologize if it's too shocking. But this is actually the patients that come to seek our treatment. They come to seek help from us. And we know that about 85% or even more from the population will require some kind of orthodontic treatment, meaning something has happened to us, something went wrong. About 30% of the population will have missing wisdom teeth, missing third molars or impacted third molars. If I would ask you, I mean, and you cannot answer, but if I would ask you how many of you had to go through extraction of your wisdom teeth, how many have missing teeth or impacted teeth or teeth that cannot erupt? We see so many cases like this in the clinic. And when I was looking at really tens, even thousands of skulls, you don't see these problems in prehistoric populations. So, when you have a problem, like, you have a problem in your car and something is not working in my car. So I go to the garage, right? And I ask them, can you please fix it? Can you change whatever is not working? But what if 80% of the cars have the same problem? What if I say that 80% of these brands of cars have this problem? So it's not just my problem of going to the garage and fixing the problem. All the cars have the same problem. So this requires a different perspective. It's not just fixing the problem of this specific case. We have to have like a broader view. And this is exactly the difference between what we define as modern medicine. When we teach our students, and obviously most of the schools, this is how we teach, obviously, we teach modern medicine. What does it mean teaching modern medicine? We actually answer the question of how this process is happening. How do we need to treat them? How do we need to solve this case? This is modern medicine, but we're dealing with a different perspective of medicine, what we call evolutionary medicine. Evolutionary medicine answers the question of why. Why do we see this problem? Why do we have so many people suffering from this pathology? Why do we see so many people without wisdom teeth, without the third molars? Why do we see so many people suffering from caries, for instance? So by using evolutionary medicine, we don't give the cure for the patient. We can't treat this specific case, but we can get a better understanding of the process. And we want to understand why this process is happening. So when we try to answer this question of why, obviously there are so many reasons that can contribute to this, to the formation of the pathology. It could be either genetics or migration, environmental factors. Really, there are a lot of factors that we have to consider. So obviously we can't address everything, but what we're trying to do in our research, in the anthropological research, is try to answer the question of why, explore some of the reasons that affect the problems that we're dealing with today. So when we look at the skulls, and just to show you briefly how it looks in the collection, you can see here some of the specimens that we have. This is the schul. This is the skull from schul. This is Kafzenaim. Kafzenaim is a young lady. Both were found in the area of the Galil, in the Carmel. They're dated to be about 100,000 years old. You can see they're very well preserved. And on this side, we can see a modern skull. Do you see the arrow? Sorry, Jennifer or someone, can you see the arrow when I pointed the presentation? Someone?
Yes, we can.
Okay, thank you. So this is a modern skull. And you can see the differences in the shape, in the size of the skull, meaning there is a difference in the way we appear, in our appearance, in our structures. Something has changed. Kafze and schul are considered anatomically modern humans, meaning we consider them as Homo sapiens, the same group of humans that we belong to. But yet we can see the differences in the size and the shape of the skulls, and obviously in the size and shape of the jaws as well, which is probably affecting also our dentition. So what is affecting our structure? Why do we see such great differences in our appearances and structure? So obviously the main reason is genetics. Genetics is affecting the way we look, the size of our jaws, the size of our teeth. A lot is obviously dependent upon our genes. And when we look at the teeth, specifically when we look at our dentition, we know that the teeth, the morphology of the tooth is really dependent upon genetics. It's really genetic oriented. And each tooth is it's actually like a fingerprint for a population. We know that each population has a specific pattern, a specific shape that we can identify. And by identifying this shape, we can identify the origin of that specific specimen. You can see here an example. This is the tooth from Nesher Ramle. Nesher Ramle is the the new group of humans that we identified last year. And I'm sure that even without being a dentist, you can see the difference between the Nesher Ramle tooth to the tooth that is from modern humans, the Homo sapiens. And I know if I can ask you, but you cannot answer, if you can identify the difference. For instance, look at the shape of the roots of the tooth. Look how the roots of a modern tooth looks like and how it looks in Nesher Ramle. So obviously, just by looking at the tooth, even without having measured anything or without understanding too much or being a dentist, you can see the great difference between these teeth. So saying that something is different, something has changed, obviously is related to the origin of the population, to genetic structure of that specific population. And we can see here another example for differences in shape. In the upper row, we can see how the tooth appears, the enamel surface of the tooth, which is the outer layer of the tooth. You can see how the tooth appears in recent humans, like us. The middle one is a Neanderthal, and the third one is Natufian, which is modern human, but is dated to be 15,000 years old. And again, you can see the differences in the shape, in the structure of the tooth. And even when we peel off the outer layer, the enamel layer, and this is what we do in our research, we have the ability to scan the teeth using X-ray, using micro-CT with a very high resolution, and to peel off the outer layer of the teeth. Obviously, virtually, we don't want to damage any specimens. But by peeling off the layer, we can see the inner structure of the tooth, what we call the dentin layer. And also we can see these differences in the dentin. Look, there's some kind of a crest in Neanderthals that modern humans doesn't have. We don't have the same appearance, the same structure of the tooth. So by looking at this, at the shape of the tooth, the morphology, we can identify different populations and different origin of populations. So this is one factor, the genetics. Another factor that is affecting our appearance and our structure is the diet. What we're eating, the food that we're eating, the food we're consuming, also affecting our appearance. You know, one of the greatest changes in modern society is what we call the agriculture revolution. Agriculture revolution is actually transferring from society, the hunter-gatherer populations, which were people who are living in small groups, like small tribes of 20, 25 people together, moving from one cave to another, hunting, gathering, collecting food, and every period, every time, moving from one place to another. The transfer from that community, from this structure of population into the agriculture. People who are settling in one place, domesticating animals and plants, starting to growing their own foods, sitting in one place. This made a very massive change in our culture, in the culture of modern humans, creating society, the structure of society have developed during that time. And obviously it had a major effect of the way we produced our food, the availability of the food, and by that also affecting our morphology and our appearance. And how do we know that? Because when we explore archaic diets, and how can we know what they used to eat 10,000 years ago? So we use methodologies of exploring the calculus, for instance. And calculus, you know, it's the thing that accumulates on the tooth, and we send you to the hygienist to remove it. So luckily back then they didn't do that. So we still have the calculus in many of the fossils, and we're able to dissolve this material, the calculus, and to explore the content of the calculus. And we can get a lot of information out of this material. For instance, the food content. We know what they ate, what kind of food they were consuming. So not only the food has changed, we also know that the content of the food, or how they used to eat it, how they used to prepare the food, has changed. Today we have a knife and fork, so we can cut our food. We can cook our food and to make it very soft, right? My children eat bamba. I don't know if you have bamba in the States, but it's a very soft food that they eat. You know, my children, when they go to school and they have to prepare their sandwiches, they ask me to cut the hard part of the sandwich because they don't want to put too much force. It's too tiring for them to chew. But back then, you had to put a lot of force when you were eating. You had to hold the meat between your teeth and to pull it very hard and to cut with a small stone. And by that, you had to put a lot of effort. You have to use your muscles very aggressively in order to eat, in order to be able to chew your food. So once you have to put a lot of force by eating the food, then you get bigger muscles and you have bigger bones, you have bigger jaws. You need to have massive masticatory system in order to be able and eat the food. How we know that? Not just by looking at the content of the food, but also we can see the marks that appearing on the teeth. Here you can see another example from the custom cave, and you can see the marks that are present on the tooth that are representing the cuts of the stone. This is actually the forks or the knives they used to use back then. What else is affecting? When we're trying to prepare our food and we're using tools like grinding stone for cutting our food, for smashing some of the ingredients, some of the particles of the stone are being integrated into the food, into the diet, and they're grinding the tooth. They're also affecting the teeth. We know that because we can see when we analyze the surface of the enamel, the surface of the tooth, we can see differences in the texture surface analysis. We can see that some of the fossils have much more grinded teeth. The enamel has much rougher surface. And this is probably related not just to the food itself, but how they used to prepare the food. So all these things together affect the force that is needed in order to digest the food, and it's affecting the size of the muscle and the size of the jaws. What else is affecting our system, the masticatory system? It's how we use the teeth, how we use it for function. So today, what are we doing with our teeth? So we're talking, we're smiling, oh, we're chewing, but obviously you can even chew and you can survive even without biting. You can get the food very softened, very cooked or grinded. You don't have to put a lot of force when you eat. You know, as dentists see this picture, they're probably, it's horrifying for us. Today we ask them, don't put too much force on your teeth. You don't want to break your crown. You want everything to be in place. Everything has to be very nice. Obviously, this is not the purpose of the teeth. And we know that because when we look at our fossils, when we look at the collection, we can see the evidence of how teeth were used. And we can see evidence of, for instance, this is again from Hoalo, which was a fisherman village. It's about 20,000 years ago. And we can see the evidence of how they used their teeth to prepare nets. We can see the structure of the tooth. We can see the marks of the ropes appearing on the tooth. And by that, we can understand how they use their teeth and not just for eating. So obviously, they use their teeth for more purposes, putting a lot of force that we're not doing so today. This is also part of the reason why they have different appearance, why their jaws are wider and bigger compared to ours. So obviously, there are a lot of other functions that we can address. This is a little bit, maybe this is sorry, 1 second. This is for the dentist among us. When we look at function, we know that we have also the interproximal attrition. This is the grinding that happens between adjacent teeth in the same arch. And we know that by putting more force into the arch, we have more attrition, more grinding of the teeth between each other, which obviously affecting the presence of caries, of black triangle, of the bone between the teeth, and obviously has a lot of effect on the ability to function and to maintain the integrity of the dental arch. What else is affecting our appearance and how we're using our teeth? So you can see here the evidence of how teeth are being used as a mark for culture. And we see also not only in prehistoric specimens, but also in some of the populations that we can still identify today, how they were changing the shape and size of their teeth, sometimes as part of identifying themselves as part of a certain group, maybe some kind of a ritual that they're trying to use. And you can see here another skull from the Natufian group, which is about 14,000 years ago. And we see here the missing tooth. And this missing tooth, this is something that we see in several specimens. This is not just the one specimen that we identify. We see it in several specimens in the collection. And when we're trying to think, why would they do that? I mean, why should you extract an upper tooth, which is in a very centric place in the face? So obviously it can be maybe to show that you're part of a certain group, you're part of a community, maybe a socioeconomic level to show that you're related to that group. Another reason that could be is due to a case of tetanus disease. You know that when you suffer from tetanus, when you get infected by tetanus disease, people die not from the disease itself, but they die due to dehydration. What tetanus causes to the human body is actually stiffening of the muscles. The jaws are being locked, everything is closed, all the muscles are being constricted, and you cannot open your mouth, you cannot drink, you cannot eat. And if you're being constricted into a long period of time, it could be even a week or two, then the people just die from dehydration. So what they're doing in these areas, in these villages, once the child is being born, they always make sure to extract one of the incisors, remove one of the teeth, in order to make sure that if you're being infected by tetanus, you will be able to be fed, to feed them and to give them water through a straw by keeping this area open. So again, the culture, the environment is also affecting our habits and what we're doing and how we're using our teeth. Here you can see another example of how people are using their teeth, how are they actually creating the shape that we saw earlier. So again, this is something that it's easy for us to imagine because we still have evidence for people who are doing that. Some of the things that we find in the collection, in the archaeological excavations, we don't necessarily know how to explain. We can only imagine and hypothesize what were the causes and why did they produce or did these marks. We don't always know, but we're trying to figure out. So another thing that we're dealing with is once we see the shape of the tooth, we see the structure of the tooth, we know that it's affecting our health. If we have a certain shape of the tooth having a lot of fissures, a lot of areas that food can be stuck in it, and caries and microbiome can penetrate into the tooth, it's causing more caries. We see more children who suffer from caries. And one of the things that we see in prehistoric population is that they have a lot of attrition. The teeth are very grinded. They don't have the same shape because their teeth are being flattened due to the function, due to the food that they were eating. We see that their teeth are much flattened. And today, when we are treating our patients, we're actually trying to do the same thing. We're taking some material, like restoration material, and we're trying to fill the tooth, to fill all the fissures and make the tooth flat. So we're actually mimicking the same procedure that was happening before due to the function and due to the environment of people. We're now trying to produce the same mechanism in order to prevent caries by flattening the tooth, filling it with the sealing material in the clinic. We're actually making the tooth flat, as similar to a case where the tooth was being grinded due to attrition, due to dental material loss. So we have all kinds of examples of how can we use the knowledge of our prehistoric ancestors in order to understand some of the processes that we're dealing today. Another example that we have is what we call non-caries cervical lesion. And non-caries cervical lesion, this is a pathology that we see in about 50% of our patients. 50% of the population will suffer from this phenomena. And this is actually the loss of dental material, of dental tissue, not due to caries, but actually due to some kind of a reason that we're not really sure why it's happening. And while we were seeing this pathology, we were looking, I saw it in several of my patients, and I thought to myself, I wonder what is causing for this pathology to happen? Why would people lose dental material, tissue material in this area of the periodontium, of the cervical area of the tooth? So I went to the collection, to the anthropological collection. I was looking to see, I wanted to see what happened, you know, in prehistoric times. I mean, I wondered if we see it in 50% of the modern population, I probably will identify it also in archaic samples. Surprisingly, we couldn't find any evidence for this phenomena. This was something that is really unique to modern populations. So then we started asking ourselves, why do we see it so common in modern populations, whereas we don't see it in archaic samples at all? What has changed? What is causing this pathology? And one of the things we thought that it could be related again to the change in function. Because teeth were used differently, and teeth were grinded, and the crown was flattened, the force distribution was different. We know from other analysis that was done using a finite element, for instance. This is a computerized model, a mathematical model, in which we take the tooth and we can apply force in the computer, obviously, in different directions, and by that to see how the force in being applied, how the stresses are being distributed along the tooth. But we were very surprised to see that in a tooth which is well preserved, like a modern tooth, which is not grinded, and we have the full crown, once you put a force on the tooth, we can see very high stress accumulates at this specific area, at the cervical area of the tooth. Whereas when we take a tooth that is similar to a prehistoric one, where in which the tooth was grinded and the occlusal surface is quite flattened, and we put the same amount of force in the same direction, we don't see the same stress distribution, meaning that the grinding of the tooth was also some kind of protective mechanism that was aimed to maybe protect the teeth from this non-cervical lesion. Nowadays, due to the change that we have in the way we use the teeth, in the function, the less attrition that we have, we are resulted in very well preserved crowns, but we have to pay with getting this pathology, because the force distribution is quite different, and the tooth is not meant, is not built and not designed to suffer these kind of forces. So what we're doing today, we're trying to apply this knowledge into modern dentistry. We're taking teeth from the clinic. You can see here, this is an extracted tooth of a patient, and this is how this damage looks like. We extract the tooth. This tooth could not survive due to this lesion. It had to be extracted. So once the teeth are extracted, we collect them, we take them into the lab, and we're trying to apply the forces and to analyze how force distribution has changed. You can see here, this is an instrument device we have in the lab. We take the teeth, we can put it inside the device and try to put the force in this different direction, and by that try and mimic what has caused this lesion to appear. And maybe by understanding the forces and to understand what caused this phenomena, we might have better insight of how to prevent it. I mean, we have all kinds of ideas of what we need to do, but I think that really the first stage is trying to understand why we as a population suffer so much from these pathologies. And this is something that we didn't have back then. This is something that is new to modern civilization. I have some kind of a question now. Do you see proximal striation on teeth in your collection? Is the current thinking that these striations are a result of repetitive frictional wear from toothpicking activity? If not, what is the cause? Okay, so we have two kinds of interproximal striations. I need to show you a figure, 1 second. Let me see if I have a figure for that. 1 second, this is almost the end, but let me see. Oh, sorry. 1 second. Oh, I got out of the presentation. 1 second. Sorry, apologize. Where's the share screen? Okay, I lost you. Can you hear me? I'm still here.
Yes, we can hear you.
I'm sorry. I apologize. Second. Okay, I don't seem to be able to reconnect the presentation. My God, just go. Okay, never mind. Let's just put it like this. Okay. So I go back to the question in a second. I apologize to whoever asked. I just make the conclusion because I can't seem to be able to get out of the presentation. So as I said, we're looking at the modern pathologies, and by exploring our evolutionary history, we're trying to get new insight in order to better understand what is causing these pathologies. And maybe it will enable us to have a better view, a better treatment for our patients. And I think that one of the advantages that we have here in the dental school is not only that we give our students the most advanced methodologies and treatment planning and diagnosis, and we're at the cutting edge of science for treatment, for dental treatment, but we also give them this deeper insight into the understanding of the process. And I think that this unique combination from for a dental practice and evolutionary medicine really give them a very large benefit and a very wide understanding of the process. So I would like to thank you. And now I'll go back to the question, but I'm trying to go back to the figure. Jennifer, is that okay?
Yeah, absolutely. You're going to answer the question about seeing proximal striations on teeth in your collection.
Yeah.
Is that okay?
Yeah, that's what I was trying to do before. Do you see the screen? Do you see the tooth now?
Yes. So the question from one of our attendees is, does Rachel see proximal striations on the teeth in her collection? Is the current thinking that these striations are a result of repetitive frictional wear from toothpicking activity? If not, what is the cause?
Okay. So we actually have two kinds of striations. It's hard to see in this figure. This is not a good figure to explain, but I will still try. Some of the striations that we see are on the facet itself, on the area that is being grinded. This is not part of toothpicking. This is something that is related to the mechanism of force between the two adjacent teeth. We don't really know how to explain. It's very strange pattern. We're still trying to understand why is it happening, but it's definitely not toothpicking. And we know that because we can identify toothpicking, which is usually appears below the contact point, which means that if you need to use a toothpicking, even if you try it now in your house, you have to put the toothpicking below the contact. You can't put it between the teeth. You have to put it in the gap between the teeth, and so we can really differentiate between those two patterns. So yes, we have evidence for toothpicking. We know that Neanderthals already use toothpicking for maintaining their oral hygiene. Regarding the striation on the facet itself, we don't have, so I didn't find so many evidence in our collection. This is something that, again, is more related to archaic samples, either Neanderthals or some of the archaic humans. From recent samples, I hardly find any. I mean, I hardly found any evidence for the interproximal striations.
Thank you. Next question from our listeners. If abfraction lesions of teeth is due to fatigue from brushing, why are the lesions not found in ruminant animals which grind their teeth continuously?
This is a very good question. It's probably, I mean, what we know now from the research, and we're really in the process of the research, we see that this is some kind of fraction is some kind of a combination between fatigue, I mean, the force that is being applied on the tooth, and the presence of acid. The acidic environment really accelerates this process. When we use to put force and grind the teeth without the presence of acids, we see hardly any effect of this area. I mean, what we're doing, we're taking teeth, which are not defected. I mean, teeth that were extracted in the clinic, they have no lesion. And we try to produce this lesion in the lab. And what we see that when we put only the fatigue force without acid, we cannot create this lesion. I mean, we see a minor effect on the tooth. Once we add the acid with the fatigue, the synergistic effect really damaged the tooth. So obviously this is part of the reason. Their diet is different. The combination that we have, the dramatic combination between the diet that we have, the acidic environment, with the force application, probably causes this the fraction lesion.
And next question from our listeners. Do modern nylon toothbrushes contribute to the abfraction or abrasions?
Some of the hypotheses say they do, but not necessarily. Again, in the lab, what we saw that we can cause this lesion without the presence of brushing. We're not brushing the teeth. We just put force and acid, and we get the same result. So it's not contributing. If you brush your teeth very hard in this region with the presence of acid, it's probably not helping, but it's not the main cause. We know a lot of people brush their teeth and not all of them have this. So it's some kind of a combination between the factors.
Okay, let's just go to a little bit of a higher altitude. You are the only dental anthropologist in Israel. Has that been difficult? Have you had to overcome factors being sort of the lone wolf in your practice?
Yes. I mean, when I started, this field was not existed in Israel. So I had to work very hard in order to integrate it into the dental school. I established the dental anthropology lab in 2015. And then I had to really convince the dental school that they should have me. And so I established a course, a dental anthropology course for students. And it took some time for the dental school to accept it, that this should be part of the curriculum, that all students should know something about our evolutionary history, about some of the theories behind what we see. And I think that now, after several years, I have a lot of students that are doing research. Most of them are dentists that are coming to the lab and they want to study evolution and they want to have this perspective of dental anthropology. I still need more people because still in excavations, I'm the only dental anthropologist, which is not easy because I have to be in the excavation, in the lab, in the clinic, and to teach. So obviously having more people will be great. But I think that we're in a different place now. I mean, most of the people know, they're familiar with this field. It's very, it's got a lot of publication also for the public, not just for dentists and researchers, it's also for the public. We're trying really to make it more approachable for the people. And we're still in the process. We have a lot to work.
So it sounds like in the last 8 years, it's become much more mainstream than when you were pioneering and creating the lab.
Yeah.
As we look at human evolution, according to your findings, Where are we in the process? You know, is the mouth done evolving? What do you think the mouth will look like in 25 years, 50 years, 100 years? If you could look into your crystal ball.
Okay, so this is a very good question. And I think it's obvious to us that we are still in the process of evolution. Now, when we say evolution, it seems like something from the past. It's not related to us, but we are still in the process of evolution. Things are still happening. When we compare our dentition to, I don't know, 200 years ago, or even 100 years ago, we can see the difference. We can see something is happening. And I don't know about, I don't know how many years it's going to take, but obviously, when I studied dentistry, and it was several years ago, so we used to study that we have 32 teeth in our dentition, and we were counting the teeth, and we had to write down, okay, this patient has only 32, or only 28, only 29. Nowadays, we're not considering the third molars. I mean, it's normal to have 28 teeth. No one thinks it's a pathology that you have missing teeth. I mean, if you have 28 teeth, it's okay. It's not a problem. And in the clinic, we see more patients suffering from the second molar impacted. And we have the feeling that we're in the process of losing more teeth. We're probably in, I don't know, for 100 years or 1,000 years, probably having 26 teeth will be normal, or maybe 24 teeth will be normal. And to be honest, I mean, we can survive, we can live with it having only 24 teeth. I mean, our diet allows it, our health allows it, so it's not a problem. You can survive even without having any teeth. So probably we're still in the process, and we're getting there, and we have to be aware of it, also as clinicians.
Continuing on this stream, what kinds of problems do you think your research may solve as you look into the future?
Again, when we talk about evolutionary medicine or evolutionary dentistry, we don't necessarily have solutions. I don't have the cure for a disease, but it gives me a better perspective. And once I have a better perspective, maybe I can design my treatment better. For instance, one of the things we're dealing with as orthodontists is what we call a relapse or a latent crowding. We finish our treatment, we do a great job, but then after a few years, the teeth are moving again. Why are they moving again? Why do we have to maintain the treatment and give you some kind of a liner or a retainer for night? I mean, we put the teeth in a certain position. Why do they keep moving all the time? And again, this movement is part of evolutionary mechanism that we have inside ourselves that has a certain purpose. The purpose of this movement is maintaining arch integrity, maintaining the physiologic function of the dentition. Obviously, our function changed today, and therefore we're left only with this movement without the main cause for it. So we're looking at it as a pathology, but we have to understand this is not a pathology. This is an imbalance between our evolutionary mechanisms to the function. Maybe one day we will be able to adapt the function to our mechanisms and to avoid some of the pathologies. But to be honest, it's not like I'm going to find a cure for a crowded dentition. And, this is my work as a dentist, so,
Understood. I think we have time for one more question, again, from our audience. What are your thoughts on width in prehistoric man and modern man with regards to airway?
Oh, okay, airway. It's a good subject. So we know that for prehistoric, okay, I will try to make it short because I have a lot to say. The change in airway is also related to our ability to speak. It's related to the development of language. Back then, in our prehistory, the system, the entire area of breathing, the pharynx, the area that is in charge of producing voice, sounds, language, was much stiffer. This area was, it's hard to say, it was less flexible and more rigid. This was due to the fact that once that we were eating much more rigid food, and it has to go through this system, this area, and therefore, in order to support it, the entire structure had to be more rigid. Once the food softened, this area, the pharynx area, also was less rigid. It enabled the ability to speak. It was more flexible. And this flexibility enabled us to speak, to produce language, but also it caused us to be more vulnerable to breathing problems. For instance, obstructive sleep apnea. Prehistoric population didn't suffer from obstructive sleep apnea, for instance, because the pharynx was much more rigid as compared to us, that is more flexible. The entire subject of the airway obviously is related to the size of our skull, to the size and the position of our jaws. This is also related to our function. Once we have a mouth breathing pattern, it affects the structure and the size of our jaws. We know that there is a very, great link. I know it's associated. The breathing pattern, the airway size to the shape of our jaws is related, and we can identify the difference along evolution.
Wonderful. Well, thank you, Professor Sarig, for being so generous with your time and for helping us to understand the past and how it informs the present and the future. Thank you to our friends from around the world for your support of Tel Aviv University and for joining us today. Thank you to the Alpha Omega Foundation, US, for your continued partnership and support of Tel Aviv University. To our listeners, as always, a copy of today's webinar can be found in the webinar library on our website, which is www.aftau.org. Have a wonderful afternoon.
Thank you.